Alright, hello everyone, welcome back. So I have this scenario from my OSCE where I have a patient called Zen Denzer, and she has she's hyperglycemic, sorry, hyperglycemic, so that she has a BCL level of 14.2. So I have to give subcutaneous medication, which is basically Novorapid, which is a fast-acting insulin, right? And I have to administer that. I'm just going to explain you guys how to administer a subcut medication, and I will show you properly how I do it as well with my equipment, right? So I'm just trying to focus on the process and the whole procedure, how I do it. So before that, I need to know that what I am trying to do, right? So I need to understand that I need to have medication chart, I need to have subcutaneous chart where I can fill that up as well. And there is a blue line because Novorapid is a additional insulin that you are giving, so there is a blue line in subcut chart where you can fill that up as well. Now I'm going to show you the medication chart that we normally have. So this is a medication chart. It looks like that, and you can literally see the name of the patient, the allergies, the date of birth, and you are doing the 11 right, which is absolutely crucial. That you always need to make sure that you are doing 11 rights and three medication steps. So in 11 rights, it follows on like right patient, right dose, right drug, right time, right route, right prescription, right expiration date, right form, right document, right to refuse, and right to response, right? So I just talk about 11 rights, and so basically you are doing that in three-step procedure. But what are the three medication steps that you normally, three medication checks that you normally do, right? So after I know that I am giving 14.2, so she has a BGL level of 14.2, right? So for example, this is I'm gonna add this as a skin. This is the belly button that the patient has. Right, so I'm gonna do hand hygiene. I'm gonna ask for the allergies. As I said, hi, my name is Hansel. I'm gonna be your Ian for today. How are you doing? Is the bed height okay for you? Is the lighting, do you want to go to the washroom before I start the procedure? And all of this stuff, right? You did the 3-point check plus additional allergy check as well. Once he's ready to go, you have to tell her that why are you doing that. So I'm giving you this BZL because it's slightly increased from it till 14.2, so I have to give you Novorapid, a fast acting insulin, to lower it down to so that you feel stabilized as well. And is that okay with you? And just asking for the consent, right? And things like that. Grab the stuff that you need, like your medication chart. As I saw here, I don't have the SSI chart, which is like insulin subcutaneous chart, but I do have this chart. So these are the two things that I need for this moment. And now bring your PPE, like your gloves, do your hand hygiene, bring your stuff. So I have so normally for subcutaneous insulin we use normally we use a insulin. There is insulin syringe that we have, but for now, for example, this is the Novorapid, as you can see, right? This is a Novorapid. So this is what I'm giving, and I'm giving 4 units. So how do you know how much you are giving is based on the chart as well, and you need to write it down in the blue line how much you give, your initials, your date of when did you give it. So once that's done, I reckon I do have the insulin thing here, insulin syringe. Did have here till yesterday, but just right here. All right. So this is a for me right now, I don't have the insulin syringe, so I'm gonna use this I don't know, random syringe for now, just to give you an example of how to do it, right? So you need this syringe. I already take out of the packet. This is the needle. Take it off the packet. This is 25 gauge needle, and always make sure that you are taking checking the dates, like how much you are giving, how much dose, checking randomly, like taking out from the bucket. So I'm doing the first check. I already told her that I will be back in the room. Alright, and then I'm in my medication room doing my first check with myself. So first check is basically you are doing with yourself when you are taking things from the drawer, right? Now, so I have my syringe, I check it, this is what we give, expiry is fine, needle as well, and Novorapid, this is the main medication I'm giving. And basically for this subcutaneous, we are not wiping using alcohol swabs because that's not mandatory as well. So we're gonna, basically, this is what we need, and 2 charts along the way. I'm gonna So once I did it, right, so I will call my RN. I'm gonna tell her, so this is what I'm giving. I'm doing checks with my RN. I did my 11 rights already. I'm gonna call my RN. I'm gonna show her like this is the expiry date. It looks fine. This is what I'm giving. I'm comparing all the things. The patient doesn't have any allergies, right? So based on that, I'm going with the procedure. So once everything looks fine and once everything looks great, you already did your checks with RN as well. Now you're gonna do the third check. So third check is basically you go to the patient's bedside where the patient lies. So I'm gonna, hi Jane, I'm back again. How are you now? All right, she's all right. Are you okay? If are you ready for that subcutaneous injection? That goes. So what are the sites that subcutaneous goes on? It goes in the belly. Normally in the belly, just under your deltoids. Under this, so basically your subcutaneous goes in the fatty tissue, because it goes in the under the layer of skin, right? So that's why you need to understand like what are the sites that we normally go with as well. And in the third check, what you have to do in the third check is that, so once I did the second, sorry, so before the third check, in the second check I will draw the insulin, sorry, I will draw the insulin from the vial, right? So I will wipe this cap using the alcohol swabs, take it out, and then I'm gonna do like for this easiness, and I'm gonna draw it up. I'm gonna draw how much I need. So I need 4 units for this case. So I'm gonna draw 4 units. Right. Right, so it's 4 units, and never cap with your hand. Always do like this. Never cap with your hand, because this is crucial, because most people prick themselves when they do that by themselves. Right, so you can lock it. So once my thing is ready, check with the RN will have a look for me, and she will tell, okay, you are ready to proceed. Now I'll take my vial as well, and I am not wiping it, as I said already. And I will do my third check within the bedside as well. I go to the patient is all right. She went to the washroom. Now I'm gonna, she's flat in the bed, and then I'm gonna put this. So she's the patient for now, right now. As I don't know if you can see that. Okay. And I have my stuff there. This is a kidney disc, for example. I don't have all the stuff that I need, but I'm just explaining what I have, right? And then you're gonna tell her. So third check done, and I'm gonna user and so basically for subcut we have to stress the skin to, sorry, we have to pinch the skin to get the fatty layer, right? So I'm gonna hold this like this, take it out, and I'm gonna do like this, and it goes on, and I'm gonna go slowly on that, and I'm gonna wait it for some time, maybe like 5-6 second or 10 just like 5 to 10 seconds, so that the skin can absorb all the things, right? I already put it there, take it out, it goes directly on the yellow sap container, right? But I'm gonna reuse this for now because I don't have it. But don't do it in real life. Just chuck it in the sap container. Once that's done, you have to report it. So that's why there's a vial over there. Just tell her the side effect, like so once you have the BZL in subcutaneous, you might feel hypoglycemic. That means your blood glucose might go down. You might feel sweating, like sweating and dryness, thirst, dehydrated. So once that's done, you have to tell her, I'm gonna make sure that you eat shortly, and I'm gonna check your vitals. I'm gonna check your BGL level after some time to understand, to know that if the BGL is working or not, right? And just give the call wheel by the side, so that she can call anyone if she wants to call anyone. And like chart in the dose time side how much you're giving in the SSI chart. As I said, like you have to chart it down at the end of the day after you did it. In the SSI chart is basically the subcutaneous chart, which it's basically tells us like the details of patient, how much insulin we are giving, and what are the things that we need to do, right? Now name the insulin 4 units time, right? I will reassess BZL in line with sliding scale. Make sure the food intake is recorded, and hypoglycemic, right? So this is basically the step of subcutaneous, right? So subcutaneous, you need to know what are the items that you need. You need to do 11 checks, right? You need to do you need to do food identify. First you need to do 11 checks, and after that you need to do 3 medication, what is this called, 3 medication, uh, right, three medication checks, as you can see here. So it says like second checks and third check, right? In the first check is over here. So that is how you do the checks, and that is what, if you can just stick with those stuff, and if you know what you are getting, and if you know like what exactly are you doing, then I reckon there won't be any problem, because it's just about explaining the things that you do over time. And subcutaneous is kind of different, like 90 degree, you are like hold the syringe like a dot and put it there 90 degree, hold it for like 5 to 10 seconds. It pins the skin for subcutaneous. The syringe that goes in insulin one, it's how much you are giving, 4 units you are giving. You will sort it out, you will write it down after you prick the skin, right? It's 4 units, and write it essential, document properly. And that's all. I think that's all you gotta do in subcutaneous. It's kind of easy if you know like what exactly are you trying to do and what exactly are you trying to achieve, right? It's just about doing the right steps and not missing anything that you are doing. But for the first check, do 11 right yourself, right? First check, do 11 rights. Second check, do with the RN. You don't need to do all rights, but check expiry date. She will have a look how much are you following the procedure or not, how much you are giving. So you will have a look, then draw it up, make it ready, go to the patient bedside, do the 11 nights again to make sure that everything is right. It's just like the reason why they have this, the rationale behind this is because many people give wrong medication, and which leads to a lot of deaths, and we try to minimize that as much as we can. And just to ensure that that doesn't happen again and again and again, we are trying to minimize that by doing the procedure again. And I know it's really mundane, and you might feel like, why the fuck are we doing this thing again? But that is what it is, and that is what everybody follows. But that's the rationale. Like, we are not just following blindly, but there is a reason why we do the things that we do, right? So I just break it down now. This is what basically subcutaneous is. Subcutaneous is all about how you do it, how was the patient and everything, right? And I will give you a new video on IM, how to do the IM as well. Thank you for watching.